joint we are going to talk about is sternoclavicular joint. This is clavicular notch of sternum. This is medial end of clavicle. The joint formed here is saddle variety of synovial joint. Next one is acromioclavicular joint. This is an accessory joint of shoulder girdle, and this joint is plain synovial joint. Plain synovial joint. The articular cartilage of acromioclavicular joint is fibrocartilage, unlike other joints, other synovial joints where you have hyaline cartilage. So next and the most important joint here is our shoulder joint or glenohumeral joint. Glenohumeral joint, as you know, is a type of ball and socket joint. Most mobile joint in the body, ball and socket. Here you have the glenoid cavity, which is enhanced by the glenoid labrum. Here you have the head of humerus. Next joint here is elbow joint complex. You have humero-ulnar joint as well as humeroradial joint. Elbow joint is an example for hinge variety of synovial joint. Hinge variety. So movement is possible only in one axis. Here will be the axis, and movements of flexion and extension are possible in case of elbow joint. And along with the same capsule or within the capsule of elbow joint, you have one more joint here, that is proximal radio-ulnar joint. So this radio-ulnar joints are very important in case of supination and pronation. This is proximal radio-ulnar joint. Next is an example for pivot joint. Remember, proximal as well as distal radio-ulnar joint, where the head of ulna articulates with the ulnar notch of radius distally. And this distal radio-ulnar joint is also a variety of pivot joint, which helps in supination and pronation. Remember, one more joint is considered here, and that is the middle radio-ulnar joint. You have interosseous membrane, so this is an example of syndesmosis. Syndesmosis joints are fibrous joints where you have two bones which are connected by strong interosseous membrane or ligament of that kind. So 3 radio-ulnar joints. Out of the 3, 2 are pivot and the middle one is syndesmosis. Then you have wrist joint or the complex radiocarpal joint. Wrist joint is an example of ellipsoid joint. Remember, in case of wrist joint, only the distal articular surface of radius is taking part in wrist joint. Ulna is not directly part of wrist joint, because here you have articular disc of inferior radio-ulnar joint intervening between the head of ulna and the triquetrum. You have scaphoid, lunate, triquetrum. Over the triquetrum you can see pisiform. So this is your radiocarpal joint between the radius and articular disc of inferior radio-ulnar joint proximally, and scaphoid, lunate and triquetrum distally. That is a type of ellipsoid joint. Movement of flexion, extension, abduction, adduction, abduction and circumduction is possible at the wrist joint. All intercarpal joints are examples for plain joints where you have slight gliding movements possible. The first carpo-metacarpal joint, that is between the trapezium and the first metacarpal, trapezio-metacarpal joint, it is considered as a modified saddle joint. So remember, trapezio-metacarpal joint or the first metacarpal joint is a saddle variety of synovial joint. Then you have other carpo-metacarpal joints. All these carpo-metacarpal joints from 2nd to 5th, these are all considered as modified ellipsoid joints. The metacarpophalangeal joint, between the metacarpals and the phalanges, proximal phalanges, These are considered ellipsoid by some authors. Some authors consider it as modified condyloid variety of synovial joint because it's not exactly ellipsoid. There is a small cupping on the distal portion of metacarpals. All the interphalangeal joints, proximal as well as distal interphalangeal joints of second to fifth digits, and the interphalangeal joint of thumb, all these are hinge variety of synovial joints. Very classical examples for hinge variety of synovial joints. Okay, these are regarding the joints of upper lip.